Hi everybody. Oh, that's not what I wanted to do. Good afternoon, everybody. Thank you for joining us. We are here for the community dialogue for Let's Talk About Suicide Prevention. Go ahead and give it just a second, and we'll go ahead and get started. Let some people come in. So if you're just joining us, thank you. We are here again for the community dialogue. Let's talk about suicide prevention. I am going to give it just one more second in case people are still logging on, and then we'll get started. All right. All right, so good afternoon, everybody. So thank you for joining us for this event. My name is Amir Abdul Hafid. I'm the program coordinator for suicide prevention at Guide. If you haven't heard about us, we are a nonprofit that's based here in Gwinnett County. It did start in the 1980s, and we focus on positive youth development as well as substance abuse and suicide prevention. And today we're hosting this dialogue about suicide prevention because today is actually the World Suicide Prevention Day. And we want to bring awareness to this, to suicide and to prevention efforts that we are joining for it. We do have a panel of experts and community members whom I'll introduce shortly that are here to talk to us about suicide and prevention efforts. How this panel discussion is going to work. We're going to go ahead and go through the panel discussion with the panelists, and afterwards we are going to have an open Q&A section discussion. If you have a question that you would like to pose for the panelists or anybody in particular, please put it in the Q&A box that's on the bottom of your screen. We are going to be monitoring the Q&A box as well as the chat box throughout the whole event, but do put your questions to the panelists or anybody in particular in the Q&A box that you see. There should be two boxes, chat and Q&A, so you'll want to use the Q&A box for that. And Michael is on as well. I'm gonna let him introduce himself because he'll be chiming in as well.
Good afternoon, everyone. My name is Michael Davis, and I serve as the Associate Executive Director for Prevention at Guide. As Amira said, we are very excited that you are here and joining us in this dialogue, and just other Guide initiatives that we've had or that we have is we address underage drinking prevention, tobacco and vaping prevention, and opioid and prescription drug abuse prevention, as well as any other drug or mental health issue that's going on. So we're very excited to have you here today, and if you have any questions, again, please put it into the Q&A box, or if you have any technical difficulties, feel free to message me in the chat box.
All right, thank you, Michael. So our wonderful panelist team, going ahead of myself here, is here. As you can see, we've got quite a few joining us. So thank you again, everybody, for the panelists for being here. I'm going to go ahead and let you introduce yourselves and let everybody know who you are, who you work for, and why you're here.
All right. Hi, I'm Isley. I'm with Fox ATL, a teen youth organization that focuses on spreading youth voice in the Metro Atlanta area. And I also founded Liberation Support Group, which is a organization that's helping aid mental health during the racial revolution. So, and I also work with that in collaboration with Kayla. So.
Hi everyone, my name is Taylor Chambers and I'm the Associate Area Director for Georgia with the American Foundation for Suicide Prevention. I am so excited to be here today. I am a loss survivor. I lost my brother to suicide in 2012, and so World Suicide Prevention Day has a special place in my heart, as does supporting our loss survivor community. So thank you guys for having me.
And hello, I'm Justin Paulison. I work for the Georgia Department of Behavioral Health and Developmental Disabilities on the suicide prevention team. This team oversees a number of different suicide prevention projects and activities across the state of Georgia, and I'm very happy to be here today.
Good afternoon, everyone. My name is Deirdre Neely. I'm one of the contact center directors for Behavioral Health Link. We are the company that manages the state of Georgia's Georgia Crisis and Access Line. Of course, we are one of the premier crisis centers in the United States, so we take pride in setting the example for other states, showing how much we take the time to take care of our community here in the state of Georgia.
Good afternoon, I'm Jennifer Wilds. I'm with Viewpoint Health. We serve individuals with mental health, developmental disabilities, and substance abuse. I manage programs for community programs and our Zero Suicide Initiative. I'm also the chairperson for the Newton Rockdale Suicide Prevention Coalition, and I'm also a survivor of suicide losses.
Hi, my name is Kayla Lomar. I'm a content creator for Vox ATL, and I'm also a co-facilitator of the Liberation Support Group with Isley. And mental illness runs in my family, and I've had my own battle with depression and anxiety.
All right, so thank you again for all the panelists. I really do appreciate you being here, and I'm excited for what we're doing with the community and the information that we're going to share. Right now, we are actually going to start off with a presentation from Justin regarding suicide and youth suicide that's in Georgia. So Justin, I'm going to go ahead and let you kick us off for this wonderful event.
Okay, thank you, Amira. So yeah, this is just a very brief and very simple overview of what we are seeing in Georgia, and then also how do we compare what's happening in Georgia to the rest of the United States. We'll take some time to look specifically at some trends in youth suicide. So if we can go to the next slide, please. And the next slide. So as you can see, over the last about 20 years, ever since 1999, the suicide rate in the United States has been on the rise. And there really has not been any year where it has gone down. It continues to gradually go up and up, higher and higher. So from 1999 through 2018, throughout the United States, the rate has risen by 35%. And over the past decade, so a smaller span of time, the rate has risen by 16% in Georgia. So generally, it has been rising faster in the United States, but it has still been rising in Georgia. Overall in the United States, suicide is the 10th leading cause of death overall. But what is truly alarming is for young adults and children, it is the second leading cause of death. You'll see there it says between 10 to 34, that's across the United States. Often when we talk about youth and young adults, we're looking at about 10 to 24. So second leading cause of death, the first one being accidental death. Suicide causes more deaths in Georgia than car accidents, than opioid overdoses, and homicides. So it is often not talked about or on a lot of people's radar, but it is a significant problem. And of course, that is why we're all here today. If we can go to the next slide. In 2017, our suicide rate in Georgia was just below the national average. In 2018, it went above the national average. So you can see the problem is continuing to increase. And you'll see in 2018, there were 1,565 suicide deaths here in the state. The 2019 numbers are a little bit higher. The rate is pretty similar, but the total number is a little bit higher. And just comparing 2018 to 2018, between the ages of 10 and 24, 229 of those people lost were youth or young adults in 2018. If we can go to the next slide. So we're going to talk about some troubling trends that we see, zeroing in a little bit on some specific data points. If we can move forward. So we talked about the rate of increase. But when we look at specific youth and young adult populations, you will see more specifically where these increases are happening. Overall, from 2011 to 2017, it's been a 56% increase. So you say, okay, in Georgia, suicide has gone up 16%, but among youth, it's 56%. It's a much bigger, sharper increase. And you can see a breakdown. Young adult males have a 38% increase. Young adult females, 178% increase. That is a huge and troubling trend to be aware of. And you can see breakdown by different racial groups. White females having the largest increase, Black males, white males, Hispanic males. And on the right side of the screen, you can see 10 to 19 years of age and 20 to 24. You can see different rates over this period of time. Go to the next slide, please. Something that has come on the radar for a lot of people, especially in this time where we are all a lot more conscious of health disparities. And there's a paper on this you can download and read. There's a recorded webinar training you can find online, but it's called Ring the Alarm, the Crisis of Black Youth Suicide in America. So this was a report made to Congress from the Congressional Black Caucus, their emergency task force, as you can read. And they are pointing out that over the last few years, there has been an alarming increase in the suicide rate for Black children and teenagers. And this is a big change from historical data. So this is something that needs to be on people's radar because it is a problem that is getting worse. And with health disparities, we're talking about significant vulnerabilities if this trend continues. So I highly recommend, after this webinar, doing a little Google search, look up Ring the Alarm, the Crisis of Black Youth Suicide, and you can see a lot of this data that has been discovered. We can move forward. And then here are a couple charts that we've pulled together. One is from the Georgia Student Health Survey. This is a survey that goes out to all the schools pretty much. Specifically is pulled from middle schools and high schools. And you'll look, it starts on the right by school year for this chart in 2015. And you can see the top row there is how many of these middle schoolers and high schoolers across the state reported seriously considering a suicide attempt during the past 12 months. So in 2018 to 2019, you have over 11% of all Georgia students having a serious thought, a desire, a consideration to attempt suicide within the past year before they took the survey. It was a little higher in 2017 to 2018 school year. The sample size also changes a bit year to year, but those rates are about the same. However, if you go all the way back to 2015 to 2016, it was only 8.7%. So even there, over a few years here in Georgia, you see the number of people reporting having thoughts of suicide, or if you move down, suicide attempts, or if you move down one more row, multiple suicide attempts dramatically increasing. Looks like students reporting multiple suicide attempts has essentially doubled from 2015 to 2018. So that's serious. If you walk into a school cafeteria and you see 100 students sitting at tables eating lunch, it means 11 of those students are struggling with thoughts of suicide, at least within the past year. So we want to be aware of that. And also, if you look at the chart on the right side of the screen, this tracks rates over the years of suicide-related emergency room visits and suicide-related hospital discharges. So why is that important? This is saying that somebody had ideation serious enough or an attempt serious enough to get them treated in an emergency department. That'll be that top line and those bars. And then the hospital discharges mean that the attempt was medically significant enough to require being admitted to the hospital and then later released. So they actually had to be medically treated in the hospital. So this is 2018 data. So if you just compare, 2018 you had 2018 you had 3,839 youth emergency room visits for a suicide-related issue. The medically significant number was 843. You recall the deaths were under 300. So you've got the deaths, you've got the medically significant attempts, you've got attempts in ideation that require an ER visit. But then if you look at the ideation being reported by the students themselves, the number is much, much higher. So it's sort of an upside down pyramid, a funnel of a huge number of people experiencing these thoughts who are at risk. Those who are reporting attempts, those who have attempts serious enough to be treated, and then really medically significant attempts. And of course, the thing we want to avoid most of all, deaths of our young people and anyone in Georgia. So I hope that these slides highlight the very important need to engage in suicide prevention activities here in our communities, in our counties, and across the state.
So thank you, Justin, for that overview. Those statistics are actually very surprising and shocking, I'm sure. So I do appreciate you sharing that and giving us the feedback, or not the feedback, but the presentation and the statistics for the event. And then who knows how it's going to change with the pandemic that started this year. We've already seen a few increases with the mental health challenges. So, and of course that data is not out yet, but it will be interesting to see how that's affected in the future. So I wonder, that leads us into the next panelist question. What does suicide look like in our communities, just in general? So the panelists, whoever wants to go first, please let us know, how does suicide, or what does suicide look in your communities? What are you seeing?
Well, I know for me, obviously I'm in the thick of it with teen suicide and stuff like that, especially. I think that a lot of adults kind of turn to social media and say that this is the reason that people are killing themselves, which I'm sure has something to do with it. But also I've seen that if you think about the reasons people commit suicide, I think that stressors has a huge thing to do with it as well. I think that, I mean, like along with suicide, teen depression, anxiety has gone up a ton. So it's kind of, I think that I've seen just my peers being stressed about the future, and that can obviously lead to suicide. So that's been my kind of experience in my community.
In my community, I've seen two things. Mostly the people who die by suicide in my community, they are a part of a marginalized group and they feel outcasted by it, or they are always being felt like they're a burden. Specifically people in the LGBTQ community, I've seen that they've died by suicide more in my community. Also, teens who are in AP classes and advanced classes, there was a kind of like a running joke in my high school when I was still in traditional high school that all the AP kids are suicidal. And now that I know that that's not really a joke, but like it's still very true.
Yeah, I do a lot of work in the community, and a lot of what we're seeing right now is families that are struggling with meeting their basic needs, rent, utilities, whatever. And so that tends to stress out the entire families. Those stressors and impact of everybody being at home together all day, every day under one roof, those school stressors now, feeling very uncertain about the future. I've talked to some child welfare workers in counties who say that they're seeing lower numbers of referrals for abuse and neglect, but that the ones that they're seeing are very high escalated. Like there's been a major incident or a hospitalization. And so those numbers, the lower levels of abuse and neglect maybe aren't being seen and caught until they're getting to a high level, which obviously is impacting adults feeling that stress in the home, maintaining the structures and behaviors in the home. And then just the youth, we see a lot of youth that are struggling with kind of that lack of connectedness and while school's been out. So.
For the crisis line, we haven't seen much of an increase in our call volume. We typically take anywhere between 700 to 1,000 calls a day from around the state. But what we have seen an increase with the pandemic, with the racial stressors that have been occurring, what we have seen an increase in since school started is counselors contacting us because the children now have another avenue again to reach out to their school counselors. School counselors are being much more proactive. Some school systems actually have it in their computer systems where if a child searches or types anything dealing with depression or suicide or self-injurious behaviors, it alerts those school counselors of what's happening. And they engage us at GCAL to see about getting some assistance out to the family and to the child to provide that support. So we have seen a bit of uptick since school has started. We were very worried, of course, in March when everybody went home. We know that the school systems are generally the outlet for a lot of children to have a safe space, even though for some children, many children, it is a difficult space, but it is typically the safe space for them to have an adult that they can trust, that they can talk to outside of the home. Meals are provided there and that sort of thing. But the wonderful thing that it seems like the Georgia Department of Education has done is realize the need to make sure that their children have access to them and, of course, engaging us much more.
And I'll say too, just from our perspective as a state-based organization, I think one of the things that we saw early on with everybody staying at home was the immediate concern about mental health. And that we had a lot of people reach out to us and just wanting to know, okay, I'm worried about people. We're not getting to see people. People are being isolated. And what is that going to do to people's mental health? And I think, as you may have experienced as this pandemic has kind of gone on, the ebbs and flows month to month, week to week, if, time has no meaning anymore, but just how that our own mental health kind of fluctuates and how maybe some days we're feeling really great and some days are really, really hard. And so one of the things that we have seen is more people reaching out. Just this has become a discussion that more people are ready to have and willing to have. And that's been one sign for us that we're still staying positive and remaining hopeful because we do have people reaching out and trying to get those resources. And hopefully that's the follow through then is the part that I think we need to be concerned about. But at least that first step is being taken.
All right, so thank you everybody for sharing what you're seeing in your communities and some of the changes that you've seen since, especially since COVID and the pandemic has started and people have gone home. It is a very trying time, and everyone's trying to get used to the new normal, as what we're all saying right now, the new normal. So And I know Isley and Kayla do work with Vox Atlanta, which is a teen-based organization. I'm actually an alum. I was writing for them when I was a teen, so interested to see what they do. Vox does do an Atlanta teen survey that goes around Metro Atlanta, and they have some questions regarding mental health and surrounding mental health. So what are some of the insights from that survey, Isley and Kayla, if you don't mind sharing? Like, what are you saying and what's surprising?
I know that we do an Atlanta teen survey every year, and we have some different results. So what we've found is that 67% of teens said that they know to talk openly about mental health, which is an increase from last year. However, on the downside of that, 61% of teens have said that they have had suicidal thoughts, and 87% have said that they know someone who's had suicidal thoughts. And that's also increased from last year. So according to Access, say it again, Kelly?
Okay, we also know that 77% of teens know where to get help, but also 7% of teens don't feel comfortable asking for help, which we thought was very interesting because we know where to get the mental guidance that we need, but it's weird that not a lot of us feel comfortable getting that help.
All right, so thank you, Kayla and Isley. It's interesting to see, and I'm glad we have those numbers. So thank you for sharing that with us. So next up, you know, it's challenging for any prevention efforts that we are, but I know that we have a lot of stuff going on, especially statewide. Justin and I, you know, we've talked before about the Georgia 2020-2025 Georgia Prevention Strategic Plan that was just recently launched a few months ago. Can you give us a brief explanation of the plan and its goals on addressing suicide prevention? I know this is statewide.
Sure. Yeah, I'd be happy to. So we worked with about over 50 stakeholders, and it was a year-long process to come up with a comprehensive revision to a pre-existing strategic plan for the state for suicide prevention. So yeah, Amir, as you mentioned, a few months ago, we publicly launched this. It's called the 2020-2025 Georgia Suicide Prevention Strategic Plan. A bit of a mouthful, but basically it is a 5-year plan for the state on ways that we can work, concrete ways that we can work to reduce and prevent suicide. So in this plan, there are 11 goals, and every goal has its own strategies connected to it and objectives. And some of the goals are about how to communicate safely about suicide. Some of the goals are about training people on suicide prevention in different communities. Some goals address at-risk populations. As Kayla mentioned earlier, there are certain at-risk or higher-risk populations and groups. And we have goals about, you know, how to deal with access to lethal means, the means by which people take their lives. So really the hope is that wherever you are, and if you are a private citizen, if you're a volunteer, if you're with a nonprofit, or you're working with an agency, you will find one or more pieces of this plan that are a good fit for you and what your agency or group is doing. And you can say, okay, these are things that we can put into practice, maybe through our network or the geographic area that we operate in. And it's really a guide for anyone to pick up and kind of have a direction for where you want to go with suicide prevention. And we're not just throwing it out there and hoping something good happens. We have actually assembled a task force to evaluate how this plan is being used over the next 5 years. So we're excited about it. Obviously, it was launched at a time where many other high-profile things are happening, and suicide prevention is not at the forefront of a lot of people's mind, but as people have pointed out, many of the things that are happening in our society right now are actually having an impact on people's mental health. So we cannot lose sight of the importance of having suicide prevention being an ongoing thing, even if it's not taking the spotlight all the time. Was there anything else you asked me, Amira, or was that about it?
That was about it, and I think you covered a lot of it, and I really do appreciate that. It sounds like the state is doing a lot, so I'm excited to see what happens in the next 5 years. And in fact, I hear you're offering one of our suicide prevention trainings, the QPR, which is Question, Persuade, Refer, later this evening. I'll have to go leave us soon to go train people to save lives later on this evening. So I just want to take this time now to acknowledge your presence here and say thank you and show some respect, appreciation, and definitely respect too for sharing this key information and being here tonight.
Sure, and thank you, Guide, and all the other panelists for being here as well. And Michael and Amira, if you want to later put out a link of how people can find the state plan, that would be great too. Not to distract from this moment, but later on, of course.
Of course, we'll include that in the follow-up email after this with all the participants. So, all right, so we've heard a lot of what the state is doing. And then we've heard, and as we know, there's challenges to prevention efforts in suicide. So what are some challenges that everyone is seeing? Like some of the other panelists, what are some challenges that you are seeing? Or the biggest challenge that you see so far?
I'll just reference kind of back to what Justin, just was talking about, is that there's so many other things, right? And so these suicides so multifaceted and interconnected, right, with so many other challenges that we're facing. So, oftentimes that's what makes it challenging for me, because you've got to look at people's history of trauma and how it has impacted their brain chemistry or their emotionality, right? Or how people have been impacted by abuse, sexual, physical, emotional abuse. It's impacted by domestic violence and young people who have been impacted or witness to domestic violence, substance abuse, mental health, developmental disabilities. And then on top of all of these kind of day-to-day stressors and these huge challenges that we're facing in our world right now, and then that kind of leads people to this hopelessness, right? And those feelings of isolation and not being connected and not feeling loved and supported and that they're worthy. And so then all of those things are so interconnected, and that makes it very challenging for me going out into the community and trying to pinpoint the how, the why, right? And then looking at the access to lethal means like Justin just talked about. So it's so interconnected and it's so multifaceted. For me, that's what makes it so difficult.
One of the challenges, and I hate to say that there's one biggest challenge, just because I think, as Jennifer put it, had a great way of saying, there's a lot of little challenges too that come up as this overwhelming hump sometimes when it comes to suicide prevention. But I think from our perspective, one of the challenges that we see is access to mental health care, especially right now if people are out of work or if they're not going to school or if their in-person classes have ceased. Some of those resources that you might typically have access to, you may no longer have access to. And we also know while telemental health services are certainly expanding and access to them is growing, that requires things like internet, that requires time. If you have young children, or like I share my space with my husband, and so if he's in the room, I mean, we're pretty open, but that being said, if you need that privacy, that can be really difficult right now. So in general, I think access to mental health services is always one of our biggest challenges. But beyond that too, it's it's letting people know what exists. And I know that all of the organizations represented today have opportunities for you to get involved, for you to get access to what you might be looking for. But getting that information out, I think, is one of the biggest challenges we face for sure.
I agree, definitely. We have at for BHL, we have our community representatives who have had their ability to go out and promote GCAL to the community has, of course, been cut because of the inability to do a lot of face-to-face. But they have found ways to make sure that they make contact, they get back in contact with previous resources, be a part of panels, continue to push that message about GCAL so that people will know that in their moment of crisis of mental health or substance use crisis, or developmental disability crisis, that there are licensed clinicians available to them 24/7. Of course, we have the services for them for mobile crisis to come out. We take care of the entire state of Georgia, all 159 counties. Doesn't matter where a person is located, if they're at Waffle House or Walmart, or if they're at their friend's house. We are going to be there to provide that support. But it's always amazing when we get out in the community and people are like, wow, Georgia Crisis and Access Line, I think I heard of that, or I've never heard of that before. And for people to know that we exist and they can have access to us is a wonderful thing that if you can't get to those providers that you're used to having, or that provider that the community provider can't do a telemental health session with you because one, maybe your phone doesn't allow you to do that and you don't have the internet access to do that. But if you have a phone, it's 11 digits to have to dial, but it's a good amount of numbers that can get you some support any time of day, any time of night. So it's still something that whenever we have an opportunity and somebody says, hey, can you come talk to our folks? Definitely, we can most definitely come and talk to your folks and let everyone know about GCAL. It's a free service. We don't charge for anything. So when we send out a licensed clinician to come and see about you or see about your loved one or see about your neighbor, nobody's getting charged for that. That service is here that DVHDD put in place along with one of the company owners who said back in 2009 and said, hey, we got something here that a lot of folks need access to. So we can't wait for the 988 to come out in about 2 years where it won't be the 11 digits you have to call. It'll be 3 digits, just like you will call 911. You'll call the 988 to get that mental health support. Because as everybody has said today, it is beyond obvious that everyone needs to have that quick, free access to mental health support. So until we get those 3 digits, we got 11 for you.
Yeah, I'll get back off of what a lot of you guys have said, but also highlighting the Atlanta Teen Survey again, out of 643 teens, 19% said they lost care because of COVID. And I think that that's something that kind of adds to that. But I also wanted to talk about like stigma, because I know that stigma is a huge thing that has prevented people from reaching out, especially I was talking about earlier in the Black community. I think that while I don't doubt that Black people experience mental health crisis just as much as white counterparts, I think that there is a stigma in the Black community that prevents people from talking about it, and in all communities as well, but I think specifically had in the Black community, I think that the quicker we get everybody to be able to talk about mental health, the quicker we can get suicide prevention and things like that and resources out to these people. So I think that's also a huge thing.
All right, thank you, everybody. Kayla, did you have anything to share before we move on to Michael? All right, so it looks like I think Isley might have spoken for both of our teams. Michael, I know you wanted to talk a little bit about some challenges that we're seeing.
Yeah, thanks, Amira. I think one thing that I wanted to point out too, and kind of add to somewhat Jennifer and somewhat Isley said, and Taylor, is also we have to look at the historical injustices that have occurred in our society that have limited our healthcare in many populations, as well as created some of that stigma. I mean, we're still looking at one of the biggest healthcare, mental health providers is our prison system, right? And so when we look at the historical injustices that exist there, we're looking at, is it okay to reach out for help? And what messages historically and generationally that's been passed down in our families, in our lives, based on our backgrounds, and in our communities of who do you reach out for? And I think Isley said, a lot of people said something about, people lost, a lot of the Atlanta teens or the Metro Atlanta teens said they lost their healthcare providers. That might be in the schools. That could be in their local organizations that are providing that. So right now in the COVID world, how are we doing that? And I think we have some great resources, and Georgia Crisis and Access Line is something that I promote for everybody because it's just a call, right? And so, or it's an app, right? So get your app out or whatever it is. They don't care about your background and your demographics and things like that. They might ask, but we have so many great resources in the community, and I think it's just getting it out. And when we look historically into other populations of people from all the different races, are we providing services in their native languages? What does that look like in our communities? In some communities, it's not there. Luckily, we're in Gwinnett and Metro Atlanta. We do have some providers that speak different languages, but what does that look like? And what about documented statuses right there, right? And will I be reported if I call in or go to this counseling session or something like that? So I think we have, as Jennifer said, it's so tied in. The biggest challenge is how do you address just one thing? And I do want to lift up that, thanks to COVID, we have expanded our telemed, as Taylor said. So we expanded the amount of people that could practice, psychiatrists that can practice in the state of Georgia, which is giving access to some people that haven't had access in their community to psychiatrists to help them. And that people that can practice, multiple practitioners from across the nation that can help our communities here in Georgia. So I think that's something to also advocate for once COVID is over and we start moving forward of, if we've seen this didn't hurt, do we pass laws and help our legislators understand that we need this? There are communities in Georgia that are desperate need of that mental health, and we have to give some more money. To me, I believe we have to give some more money so GCAL can expand their services and we can do better work throughout the state of Georgia.
Perfect, thank you. Sounds like there's a lot of some challenges, but there's also lots of opportunities for the community and organizations to kind of engage in this work and help get the word out, and just bring awareness to all communities. So let's hear from some others about what they're doing. Taylor, let's go ahead and start with you about what the American Foundation of Suicide Prevention, like what programs they have or some stuff that they're doing statewide.
Yeah, thanks so much, Amira. So as I kind of mentioned briefly, we are a state-based organization. So we do work anywhere in Georgia. I like to say, all the way almost to Chattanooga, down to Valdosta, from Columbus to Savannah. So that whole kind of border area. And what's really cool about that is a large part of what we do is bringing prevention education programs to the community. We shifted very early on with COVID and made that a virtual opportunity. Prior to the pandemic, if you can believe it or not, we were not doing virtual programs, which as a millennial, for not having those virtual programs, it's like, what's going on? Why would that not be an opportunity? So we have shifted and we have gone into doing virtual programming, which for us is awesome because and I kind of alluded to this, we are getting to reach people who we have not been able to reach otherwise. We're getting to have conversations in much smaller settings where I live in Atlanta, and so I can't always drive to Savannah because that's very cost intensive and we need to be very cautious about how we're using our funds. But I can jump on a Zoom call now. I think that Zoom has really become the norm. And while I know a lot of us are sick of sitting on Zoom calls all day, we also have that opportunity to connect and reach out to people in a way that we really never have. So that's been really cool for us. And in terms of the organization, we really are volunteer based. There's just 2 of us on staff. So everything else that we're doing, it's a great way to get involved with your community if that's something that you're passionate about. We train people to go out and do presentations, virtual presentations right now in terms of prevention education. We connect loss survivors with support resources, and we focus on advocacy too, because that is a huge part of making sure that the work we're doing and the work that everybody is doing is sustainable. We feel very passionately about not being just siloed in suicide prevention, that yes, we're one organization, but it really is by partnering with other organizations that we're going to have the greatest impact. So that's something that we've really enjoyed doing too. And just keeping things going virtually, even if it's hard, even if it's difficult, even if I had a call earlier this week that 30 people registered and 2 people attended. But if I can reach 2 people, that's 2 more people that I wasn't going to reach otherwise. But keeping up the work that we're doing now has been fundamental for us.
Thank you, Taylor. I'm glad we're collaborating now and for future events. So thank you. And does anybody else want to go ahead and chip in?
Sure, I'll go ahead, talk a little bit more about GCAL. So the Georgia Crisis and Access Line, again, is the state of Georgia's crisis line where anyone, doesn't matter who you are, doesn't matter your socioeconomic status, doesn't matter who you're related to, doesn't matter who you know, don't know, doesn't matter where you're located, doesn't matter what time of day it may be. If you are experiencing some sort of mental distress, you can call us. And you will speak with one of our licensed clinicians. We have a staff of licensed associate professional counselors, licensed master level social workers, licensed clinical social workers, licensed professional counselors, and we do actually have a sprinkling of marriage and family counselors that are with us. Our goal is always to take the opportunity to speak to the individual, find out what's going on, conduct what we call a crisis assessment. Our goal is to determine whether or not that individual is safe. Once we can find out what's happening with them, then at that point, we will determine what we can do to provide continued support. So we're not counselors in the fact that when you call us, we set up another appointment for you to get in contact with us. Our goal is to make sure that we can that we can see how we can connect you to someone within your community that's close to you. So it isn't a financial burden. It isn't a burden to try to get in contact with those providers so that you can receive the ongoing support that you need. Now, some calls may wind up to be in a position to where we say, hey, we really do think you would benefit having a counselor actually come right now to see you. So when that counselor comes out, they'll come out with another professional with them, one of our field care consultants, to provide some support. They'll take the time, talk to you to make a determination of what we can do to continue to provide that support to you. If someone, of course, is in immediate danger where they're not safe by themselves or the people that are with them are not able to keep themselves safe, then of course we will engage EMS to come and see what we can do to ensure safety, or law enforcement ensuring safety, to get that person to some immediate support. The other thing that we have that is awesome is our MyGCal app. It is the app that we created with support of DBHDD for the age group of 10 to 26 years old. that is the application where if you don't feel like picking up the phone, and I'm an old lady, so I like picking up the phone and getting on and talking to people. But we know that a lot of people feel much more comfortable getting on the phone. You got an app you can download, and when you want to engage with somebody just to receive some support, talk about your day, if it was a rough day, we want to talk to you, because also with that generation, as Isley and Caleb reported, well, I mean, can I really trust you? Can I actually reach out to you and I not feel like you're going to just be pounding on me about what I want to talk about? Yeah, you definitely can. Our MyGCal app is managed by our master and bachelor level staff that are unlicensed. So they have the training, and our main group is our certified peer specialists, which we are extra excited about having, that we've added that group of professionals in, because they are providing support from an area of recovery. Not when people hear recovery, they think, oh, it's just substance use. No, it's substance use and mental health, where they have been able to, are in a position now where at least 2 years they have been able to remain sober. They have been able to manage their disorders, and then be able to go out, be trained, and provide that support to someone else. The whole goal of MyGCal app is to instill hope. We have a wonderful administrator for that app, Brian Anderson. When I say dynamic and it comes down to instilling hope to people, I get so excited about it. This has been my baby since we have pushed it out, to get that out, especially to our 10 to 18-year-olds, so that when they want to, in the middle of the night when everybody's gone to bed and they don't have to talk to anybody, but they just want to get on and chat and text with us, they can do that. And we're going to be right there with you. We're going to provide those pointers that will be supportive to you. Now, do you have to tell us who you are, where you're located, your age, and everything? You don't. We do ask, but you don't have to tell us that information, because we want you to feel comfortable. Now, of course, if it does get to a point where it's escalated and there's a concern of danger, yeah, we're going to try to help you out. You may, some folks don't want that. But again, our goal is to support you, make sure that you're safe, and give you the things that will be beneficial for you to go on. And again, the goal of MyGCal is to instill hope. So I'm going to, in the chat box, I'm going to put a link in there to our videos on YouTube. Gives you a quick little overview about MyGCal, also about GCal, and a link to our website. For those of you that are maybe just looking for a provider in your area, you can actually go to our ASO website and you can put in your zip code, and then you can put in what service, your type of service you're looking for, and it'll pull up all of those providers in your area. But again, if you ever need us, we are always there for you all. And of course, the number you'll see here on the flyer is, of course, it's a secondhand number for me. I think I know the 1-800 number better than I know my own cell phone number. But it is a wonderful service. And also, let me add this in too. A lot of people, when they call us, they think it's like calling 911. It's not. It is a crisis line, but we're going to take the opportunity to talk to you. So if you call in and you have to wait, be patient with us. Hang in there with us, because as soon as we say, hi, my name is Deirdre, how can I help you? At that moment, you already know you're in there, and we're going to take the time to talk to you and give you the support that we can give you. All right?
Yeah, I can talk a little bit about what we're doing in the community. Again, I work with Viewpoint Health. We serve individuals with mental health, developmental disabilities, and addictive diseases. We have office sites in Gwinnett, Rockdale, Newton, Fulton, and DeKalb, and we also have a statewide program for youth that have significant mental health needs and their families. We do a lot. We do everything from like individual and family therapy and medication management in our outpatient centers. We also do school-based mental health and I looked this up today, in 29 schools, elementary, middle, high schools, and alternative schools. We got 14 in Gwinnett County. We also have mental health screeners that serve Gwinnett County schools, and they identify any of those early intervention needs, youth that aren't yet diagnosed, but they're having challenges at home or at school, and they help those families get connected to the appropriate supports and services. We also have a crisis stabilization unit for 14 to 17-year-olds who are at a high level of psychiatric crisis, suicidal, homicidal, or at risk of harm to themselves or others. We also have a community-based autism program for youth and young adults. And we are also opening soon an autism-specific crisis inpatient program where the youth will be able to stay for up to about 30 days for stabilization and assessment. We also have some suicide-specific grants that are able to offer community trainings, wellness events, staff development for your organization, things like that. If you're interested, all free to you all. We have many counselors that are trained in different suicide-specific modalities. And then we also have a suicide-specific, a survivors of suicide attempt group for young adults ages 18 to 25, 18 to 24 really, and then we're working on creating and starting a new group in September actually for those who are 25 and over and have made suicide attempt or attempts. So we have a lot going on. So yeah, we can fit kind of every level of need.
At Guide, we have a lot going on as well. We serve mainly Gwinnett County, but we have some services for everybody. So one of our big things is we do monthly QPR trainings online that anyone can sign up for. They are virtual right now, but when we're back in person, we'll be back doing those in person. So check our website out to find those monthly QPR trainings for free. So you can be anywhere. We have youth mental health first aid trainings that we're also able to do virtually. So sign up for that. We have a lot of great partners we have been working with. Just some quick shout outs. The Gwinnett County Fire and Emergency Service Department, we are working with them to provide all of their firefighters and emergency services personnel QPR training so they can intervene better, they can help each other better. And I think I saw Chief Nick on here as well. So shout out to Chief Nick for making that happen with his firefighters. That will be a great service and to get more people trained in our community. Also, I know Water Resources are interested in getting their staff trained as well. So huge opportunity there. We also work with our high schools. We have a South Gwinnett High School starting a youth action team to address the stigma of mental health and mental wellness and suicide prevention. We're very excited about that team up and running. So if you're a parent and you have youth in that South Gwinnett High School, tell them to reach out to Miss Beavers, the counselor there, and hopefully get involved in that youth action team. As well as Guide does a lot of substance abuse prevention work in all of our schools. I can't speak highly enough that we are very connected with Gwinnett County Public Schools Counseling Department and their wellness department, and then the health and PE department at Gwinnett County Public Schools. So we talk about substance abuse prevention because we know that goes hand in hand with mental health, right? Sometimes that's some of our first signs that people are struggling, that substance abuse use or misuse in our youth and in adults. So really looking at that, and Guide is just a resource to get anybody that we can help, or a resource warehouse. So we have handouts and we have flyers, and Amira has some flyers that are about to go out very soon in Gwinnett Daily Post. And one of our great partners is the Gwinnett Daily Post that gets our resources out to our home community. So stay on the lookout and feel free to reach out to Amira and I if we can do anything or get you resources, especially if you're in Gwinnett County. But if you're not, if you're anywhere in the metro Atlanta area, please let us know. And if you're further than that, we are always willing to be a resource and service.
At Vox, we create a lot of mental health content. We even have our own mental health subsection of the website when you go in at voxatl.org, and we have pieces about men's mental health, teen mental health in quarantine. We have short PSAs about mental health, and so I encourage everybody to go check those out. It's not only for teenagers, it can be beneficial for people of all ages. I have an article that I put out earlier this year about men's mental health, and it can be pretty beneficial for any masculine presenting person.
All right, awesome. So thank you everybody for all the thoughtful answers and the information and resources that we have shared. Again, I can't say thank you enough for everybody for being here. So we are gonna go ahead and open it up to everybody, all the attendees, participants. If you have any questions, do go ahead and put it into the Q&A box on the bottom. And we're gonna see if we have any and ask the questions. If you have a question specifically for somebody, go ahead and just put that in the Q&A box as well. And we will definitely have you have your answer.
And Michael and Amira, I have a couple extra minutes that I've gained. So if there happens to be any questions that I can answer, I could probably take about one before I head out, just in case there are any.
Perfect.
Is there any questions for Justin? Make sure you put them in there. Amir, if you'll go to the next slide for us, please. We know we're coming up on the hour, and some of you can only give us an hour. So if you have to jump off at this point, please take that Prevent Suicide talk, bit.ly evaluation, or snap that QR scanner. We will be sending the PowerPoint out after this as well, so you'll get all of those amazing facts that are happening there. Evaluations are very important to us. Justin, as our funder, will tell you we love to give them numbers of here's what people are saying. So looking at any questions in the Q&A box, if you have any questions, please put them in. With that, I guess, Justin, to hit one last thing, you've talked a lot about what's happening across the state. You've talked about kind of the trends and the 2020 kind of suicide plan that's come out to address that. But what are you seeing across multiple providers that you just want to take time to highlight? Because we have people from across the state and maybe even the nation joining us today. Are there any other great programs out there that you just want to highlight to make people aware of?
Well, I think that the self-quarantine and isolation challenges of COVID-19 have caused a lot of providers to have to reevaluate how they do suicide prevention work. Now, suicide prevention, of course, can be multifaceted. You can have, kind of traditional prevention work, which is before somebody's in crisis. You can have intervention, which is a lot of what GCAL does. You're helping someone who is in a suicide crisis. You also have post-vention work after a suicide loss. How do you help the community, the family, the friends who are survivors of that loss? You also have upstream prevention, which is how do you build resilience before someone is even in that high-risk category. So we do look at, all 159 counties, all 10.6 million Georgians, but the challenges has been, how can we continue to do prevention, intervention, and post-vention while maintaining social distancing and all this other stuff? So I think telehealth is great. There's been a lot of advances for telehealth. But I think something that's caught on a lot is looking at CALM as a training modality and also as something that clinicians do. So CALM stands for Counseling on Access to Lethal Means. You can find information about that through the Suicide Prevention Resource Center, SPRC. There's some free online trainings. You can also find more traditional in-person trainings that usually aren't free unless they're being offered by a provider or an organization. So I see a lot of heightened focus on counseling on access to lethal means as something that people need to be aware of and people need to be talking about, especially as people are stuck in their house more and more. There may be firearms, there may be lethal medications, there may be things in the home that heighten risk of a potential suicide crisis. So on our radar, we've seen that become a heightened focus across the board.
Thank you very much, Justin. We did get a question in here, and Justin, you might be able to answer it, or other people can jump in if you have to jump off on this. And it talks about prevention. Does it just include finality? So the act of suicide or dying by suicide. The person asks, youth in their community exhibit suicidal tendencies like drug use, criminality, self-mutilation. And what can someone with like a youth certificate or a youth provider do to help address those suicidal tendencies?
Sure, I'll say a little bit about that before I jump off, and maybe some other people have some good insights. But there are a lot of risk factors that we look at, and substance abuse is a big risk factor. Non-suicidal self-injury is sort of the technical term for things like cutting, harming yourself without the intent to actually die. Engaging in risky behavior or self-injurious behavior is definitely a risk factor that can heighten future risk of suicidal behavior. But yeah, we care about all of it. You know, obviously we want to prevent suicide deaths, but we also want to prevent suicide attempts. We also want to prevent suicide ideation. And as we talked about, those numbers get bigger and bigger almost exponentially. So even before suicide ideation, you have people who have risk factors, maybe they're experiencing despair in their lives. So when we talk about upstream prevention, how do we build resilience in people and emotional intelligence and connectedness before we even get to the point of having a crisis? So I think a lot of the people here, a lot of the panelists are well versed in that as well. And I do need to step off to go to another training, but I do thank you, Guide, and everyone else for this opportunity. And it's been a pleasure.
Thank you, Justin.
Thank you.
I do want to jump in. I don't know if anybody else is going to jump in, but the other bucket of Guide's work, we do prevention work. The other one is positive youth development. And we focus on training youth providers on how to build those resiliencies and those looking at like ACEs and how do we get that fulcrum moved so that there are protective factors around our youth from an early age. So we start we work with DFACS and Georgia After School Network, helping provide trainings for all those youth providers. So we do get some of that, and we can build some resiliency stuff there. And also every presentation, if you've been to any of my presentations on our prevention, even drug and alcohol use prevention, I talk a lot about how do we build resiliency in all of our programs, whether that's a school classroom or parenting, because a household is a program, so our parenting styles into if you're an after-school youth provider, a club provider, a pre-K, anything, any different level. So that is something that Guide is really part of in that upstream prevention as well. Does anybody else want to jump in and kind of say any more to that?
I think you and Justin said it great. Yeah, looking at all of those things, some other things that I know that the schools are doing, specific programs a lot of schools are really doing that social and emotional learning now and really looking at that emotional intelligence like Michael was talking about. So a lot of schools are working on social emotional learning, social emotional wellness, and it's got different names in each district, but they're really trying to incorporate that in every program and in every aspect of the day. And then some specific programs that are out there that some schools have used, I know, are sources of strength and signs of suicide. And they both do all of these same things that we're talking about, building those positive supports and pro-social development.
Excellent. I have a question that I'm going to call everyone on one at a time. But I think this is a good question. How does a person get involved in your program? If they want to either volunteer or become a member, how can they get involved, and what opportunities are available for them to get involved with that? And I'm going to start with Taylor. Can you talk a little bit about how one might get involved with AFSP?
Yeah, absolutely. So I did drop the link in the chat, and thank you so much to Deirdre for suggesting that. I definitely stole your idea. And it's afsp.org/Georgia. That's going to take you to our page. If you do a Google search for us, you'll also kind of stumble across it. And we take volunteers of all ages, all ethnicities, from anywhere in Georgia, all sexual identities, kind of the whole spectrum of our population. You can get involved in terms of volunteering with us by doing prevention education. We can train people to go out into the community to do that. If you're a loss survivor and you feel passionate about connecting with other loss survivors, that's another great way to get involved with us. And one of the easiest ways to get involved with us is to sign up to become a field advocate. All this information you can find on our website in addition to the volunteer application. But becoming a field advocate, you just get kind of notified about what's going on at the federal and local level, and can take action as a result of that. You'll get everything you need to take that next step and let your legislators know how suicide prevention matters to us. But yeah, afsp.org/Georgia. You'll see all the resources we have in addition to the volunteer application. Great question. Thanks, Michael.
Thanks. Deirdre, can people get involved with GCAL or Behavioral Health Link?
So the best way for the community to get involved with GCAL is to tell everybody about it. We are an organization where we're not in a position to accept volunteers. We have to make sure that everybody that answers the phone is either licensed or has, of course, gone through our training at a bachelor's or master's level to support our callers. So the best way to support us is to tell everybody about GCAL and the My GCAL app.
Excellent, thank you. Jennifer, is there a way to get involved with Viewpoint or the coalitions?
Sure. Viewpoint Health we do have confidentiality restrictions with Viewpoint Health. However, if somebody is interested, and typically we do this for college age students or people looking for their licensure, but we can accept volunteers in our programs. They do have to go through our whole training process and program that new employees do. You know, and again, it's all for confidentiality really purposes, and to make sure that you have all the information that you need to go in and do the most effective role possible. Through the coalition, yeah, I would be willing to talk to anybody about what opportunities might be available, talk about your strengths, your interests, where you might see a role, whether you are a loss survivor and want to talk to other people, whether you are great at social media and want to do posts, whether you're a good event organizer and want to do events or a flyer, or yeah, whatever somebody's interests and strengths, wherever they lie, we can absolutely use you and find a way to help you.
Excellent. And Isley and Kayla, if I'm a high school student or a middle school student, are there ways to get involved with Vox and the work y'all are doing?
I believe the fall 2020 application process is closed for this year. For Viewpoint. But there is a way to apply for next year when that time comes around. But I would say a way to support us right now is just by reading the teen content, getting familiar with the content. So when next semester does come around, you'll kind of have a feeling of how we do it at Vox. And yeah. If Isley wants to add anything to that.
Oh, yeah. You can also become a contributor if you would like to. While our teen staff applications are closed, you can always contribute to Vox. So that's open to any teen. And also to add to our program, LSG, Liberation Support Group, we have a group chat, and group me, and we take people year round. So.
Excellent. And I think I can speak for all the agencies of following us on our social media, as far as Facebook, Twitter, Instagram. All of our agencies would love that, and spreading the message. Share our post, share AFSP's post, GCAL's post, all of our Vox's content. That helps get our message further out in the community. So that is one easy way for you to get involved. Last question before we go to our final question. And this is going to be for, unless there's more that pop up in the question and answer box, for Kayla and Isley. You talked about the Atlanta youth trend. Just yesterday, Vox hosted for some of their staff their own QPR training to get that. Can you tell us about some maybe things that people should be keeping their eyes open for that's coming from Vox to kind of address some of the trends that they're seeing in our community?
Yeah, so we just got some content with that, so there should be something there soon. But as Kayla said, we also have like a bunch of other mental health content as well. So.
Yes, specifically QPR related, we should be on the lookout for a zine or a zine. It's a cute little piece of content that can go out about QPR, as well as other articles about QPR and just video content of the workshop that we had yesterday.
And in case
VoxATL.org.
Yeah, at VoxATL.org.
And in case you're out there and you're a QPR person, the content had nothing to do with QPR. The content they took was lessons learned and other stuff, conversations about how they can use that in the community. So don't freak out, QPR people. We did not record any of the QPR trainings.
Sorry, we should have been more specific. Yes, it was strictly Vox related and what everybody learned in the workshop.
Yes. Exactly. So with that, I believe.
Well,
yeah.
I'm going to cut you off. I'm sorry. But just a note that came into our box over here. Vox Atlanta is actually, it's an outlet for any teen who wants to publish with us. And then also it seems like they will be taking more teens later in the fall. So do keep an eye out for that on their website. And it'll probably be after their newest members that just went through this round of applications have settled in. So there's going to be another opening later this fall. So if you know of any teens that are wanting to join, keep a lookout on that on their website, which I put into the chat box. So the last question that we have before we sign off is, what is one thing that everybody can do to prevent suicide, even during this pandemic when, you know, we have so much other stuff going on?
Well, something I learned yesterday in the training is really, if you have an inkling, even if it's a small inkling about somebody, and if they may be having, even if it may seem like small suicidal ideations, if you see it and if you feel it, you should definitely ask them. Even if it's awkward, you should definitely ask them, hey, are you thinking about killing yourself? Because even though that's an awkward statement, it can truly save a life. So I would just say, get past our own awkwardness, and if we see something, ask.
I'll just piggyback off of what Kayla said, because I had a little response typed out, and it literally says, if you're worried about someone, ask, reach out. That is so important, and we can't say it enough, but it really does just take one person, and asking directly, it will be uncomfortable, but if somebody were to ask me that directly, it's like, what are you going to do? Just lie to the person? And you might, but keep that conversation going. Start that conversation now. And if nothing changes, reach out again and keep reaching out. But you can be that person that they come to, they turn to, and connect them with those resources. Every single presentation we talk about GCAL because it is a great free resource. And put that app in your phone. It's in my work phone, my cell phone. I've downloaded it on my husband's phone, because you don't need when somebody, you don't know when somebody will need it, but you'll want to have it just in case.
Yeah, like Taylor, I had a little response out too, and it covered both of what they both said too. Don't be afraid to talk about it. If you see something or hear something that raises a red flag for you, doesn't seem right, Ask more questions, ask if they're thinking about killing themselves. I just put some numbers down that we have over 1 million people in the United States are estimated that they make a suicide attempt every year. And Justin talked about our local numbers earlier. And we have over 1 million that are closely affected by a suicide death. So we've got a lot of people out there that are hurting. And you never know when you might be the one to offer that hope and get somebody to some help when they may not know how to get there. Yep. So do you see a trend? Don't be afraid to talk about it.
I think one thing I agree with everyone said, so I'm gonna do something new. Beat that wellness drum. Like, I mean, just be a model of taking care of yourself and admitting when you're not okay and checking in with each other and checking in with your loved ones and taking care of yourself. We are all living through a pandemic and a racial revolution right now, and the racial injustices that have plagued generationally. So be that person that says it is okay to go for that walk. It is okay to exercise. It is okay to eat that piece of pizza if that's what you need. Like, it is okay to be healthy and be well. And when you're struggling and need help, be the example of reaching out and saying, no, I need to talk to somebody right now. Whether that is GCAL, and which is in my phone, I have given it to friends, to loved ones, to family members that have needed it. And I said, in case I'm not here for you, when you call me in the middle of the night, GCAL is always there, 24/7. So I give that number out and that app out to friends all the time. I text it and say, and they're like, why'd you text me this? Just in case. So it is okay to beat that wellness drum, and the more we talk about it, the more we address stigma. That it is, we are here for each other and we need each other. So continue doing that and taking care of yourself and your loved ones around you.
And I don't really have anything to add to that. Everyone has said everything that I would agree with. So yes, be comfortable with the uncomfortable. Have that awkward discussion, because you never know if you're saving a life when you do. So, and just take care of yourself, practice self-care. I know that's been a huge trend since this pandemic and quarantine. So, and it doesn't need to be just during quarantine. It has to continue on past that. So unless there's a few more questions, I don't think we do have any more. So we're going to go ahead and just move forward. Again, here is the link and QR code for our survey. We do ask you to fill that out if you can. Again, we are going to be sharing this PowerPoint and some of the information that was mentioned in today's discussion. And do check out all the links that was put in the chat box. Self-compassion. And self-compassion's right. So Jennifer, I'm going to actually let you speak a little bit about that.
No, I just like that because I feel like it takes that self-care kind of to the next level, you know, when I think about it. You know, yeah, we're all trying to eat right, and some days we do it better than others, and we're trying to walk or exercise or clean the house. But you know what? We might not be able to get it done every day, and we have to have a little bit of grace on ourselves and a little compassion on ourselves, that we don't have to do it all, and there are some times that we just have to be at peace with that. So yeah, I liked that, kind of taking it in that direction also. Yes, do the self-care, but you know, don't beat yourself up if you don't get to the gym today, or don't beat yourself up when you eat the piece of pizza, and even though you know you're supposed to be eating healthy. So have a little, you know, like I said, a little grace on yourself as well.
Right, yeah. The hardest thing you can do is forgive yourself. So do practice that self-compassion. Very good. All right. So again, I just want to thank everybody for joining us, especially to the panelists and all the community members outside that joined us. We are so happy that you joined us today, and I hope you learned something and got some information. All of us here, we did put some information in the chat box. Check it out. If you have any questions, you can definitely contact myself or Michael. And we will be more than happy to guide you in the, pun intended, guide you into the right resources and get you the help or assistance or resources that you need. All right.
Fill out the evaluation, and thank you all for coming today.
Thanks, y'all. Let us know what we can do to support you.